Alrighty, everybody. Welcome to your class for week 6 today. I'm going to go ahead and share my screen with you. All right, just a few reminders for you. This is straight from your calendars. You have A&P quiz number 5 due this Saturday at 11:50. You have your ATI Farm Made Easy quiz 4 due on Saturday as well. Your ALT for GI meds will be due on Saturday at 11:50 p.m. For skills, it's your nutrition, feeding, and eating module. It is due at 11:50 p.m. on Saturday. And your midterm suffixes Canvas quiz number 3 is also due at 11:50 on Saturday night. Make sure that you are looking at your calendars in case you forget any of this. This will also be posted in your Canvas. Okay. So this is your week 6. We're once again talking about some of the most important things related to medication administration. If you follow along in your books, we're looking at chapter 11 in your med admin book, not your skills book, the calculation and dosages book, and then also in chapter 17 in the big foundations book, the Bible. Okay. So today we're going to talk about how we'll explain how decreased hepatic and renal functioning affect medication absorption and excretion. We'll discuss factors that affect a patient's response to medications, identify the nurse's responsibilities regarding medication administration. We'll talk about the 6 rights of medication administration again. We will also review drug distribution systems. We'll talk about enteral and percutaneous routes of medication administration, and we will also describe factors to consider when choosing those routes of medication administration. You guys are probably talking about this in pharmacology as well, so this should be just kind of like a little reminder for you that the liver is there for metabolizing your drugs, and the kidneys help to eliminate those metabolites, which are substances that are produced by metabolic actions, which result in the breakdown of the drugs. So that's what your kidneys are for. They help to eliminate those from the body, all right? Remember that medication absorption and excretion will differ for each medication. Some medications may stay in the body for several hours, some may stay in the system for several days, all right? And this is another reason why your drug guides are so important, because you can see these things when you're looking up your medications. So always consider the hepatic, your liver, and your renal function, because decreased function for either of those will have the potential to prolong the length of time that the drug will stay in your body and will continue to be active. So for this reason, if the medication stays in the body because of renal or hepatic failure or malfunction, the patient can become toxic. Those medications can be toxic to the patient, and we would need to intervene at some point, because we do not want it to be to the point where it could cause the patient to die, right? This is just a review, those factors that affect patient's response. We talked about this last week. Remember your age. We said that very young patients that we may have, their kidneys and their livers don't function as well because they're not fully developed yet, and are very old. They have decreased liver and kidney function. So those things will affect the way that their medications are metabolized in their bodies. Remember, we talked about weight. Some medications are based on weight, as in, with children, chemotherapies and things like that. So we want to be mindful of that when it comes into the patient and their medication response. Physical condition, we said, overweight people may require higher dosages than those who are average weight, and that those who are underweight may require lower drug doses. Environmental temperatures, this is just a reminder. We said that the drug may be metabolized quicker when the patient is in a warm environment as opposed to being in a cold environment where it may be slower. Gender, we said, that women have a higher body fat than men, so those drugs that are fat soluble will accumulate easier in their body. we also talked about last week that pregnancy and lactation could also have an effect on the fetus or the newborn when mom is lactating. Okay. The amount of food in the stomach. We also said that some meds need to be taken on an empty stomach. And then we said that there's some medications that should be taken with food. So we always want to be sure of which medications those are. Once again, you refer to your drug guide based on which medications you're actually going to be giving to your patient. Okay. We talked about ethnicity and patients' responses to medications. Some medications are metabolized differently based on the cellular makeup of different ethnicities. So you'll need to take that into consideration when you're giving those medications as well. And the route of administration. Remember, we said that we really need to know how we're giving this medication because we need to know when it needs to start working, how long we want it to work for, and so we need to be mindful of the route of administration, knowing that meds taken by mouth or PO are going to take a little longer to work than meds given by injections or IV route. So we always want to be mindful of these factors that will affect your patient's responses to these medications when we're giving them. All right. Just a little reminder, you, the nurse, will be legally and ethically responsible for ensuring that your patient receives the correct medication that has been ordered by the healthcare provider. So if you receive an order that looks like this and you just can't read the handwriting, it is your responsibility. If you are not sure of what this says, you're not sure of how they should take it, you make sure that you understand exactly what is written here. And if you don't, then it is your responsibility to clarify that order, all right? We do not have the luxury of not knowing information. So if you're not sure, then we need to be sure that we check with the provider who wrote it. We need to clarify and make sure that it's correct before we end up making a costly medication error. Okay. Drug distribution systems. Let's talk about unit dose systems and computer controlled dispensing systems. Right. First, before we begin all that, let's see if we can remember all of those items that a medication order from a healthcare provider must have. Right. You must have a physician signature, if you'll remember. You must have a date. You must have the name and the dosage of the drug. You must have the route and the frequency. Let's go back to this last slide real quick. And we can verify that this is indeed a correctly written order. So like we said, we need to have the physician's signature. Right? Looks like that's down here. Right? We need to have the date, which is up here. This is very old, 6/23 of 1995. Right? We need to have the name and dosage of the drugs that we're trying to give. I do not understand what this says. Zindel, Plendel, Lindel, I'm not sure what this says, so my job would be to make sure I clarify with the doctor what this says. All right. We've got ferrous sulfate, so we'll take this one, ferrous sulfate. That's the name of the drug. The dosage of the drug is 300 milligrams. This doctor is dispensing 100 tablets. That's what this number and the 100 means. We want 300 milligrams by mouth, so it's PO. TID, which would be 3 times a day with meals. All right, so we've gotten a physician signature, we have a date, we have the name and dosage of the drug, we have the route, and we have the frequency. We also have our patient's name written here as well. All right, so this is very important that we have this information, all of these important pieces of information when we're looking at our medication orders. All right, so let's go back to our drug distribution systems. Right, there's 2 types that I want to highlight here, the unit dose system and the computer controlled dispensing systems. The unit dose system is something that we really see more in long-term care facilities. This is typically used with a portable medication cart that contains the drawers. As we discussed last week, the unit dose is an ordered amount of medication that the patient is supposed to receive at a prescribed time. So it's all broken down based on when the patient's going to receive it. Right? So if you guys have been in a facility, if you've been working there, then you'll see the nurse or the medication aide. They'll transport the cart from room to room, and they make sure that their patients get their medications in a timely manner. If you're using this system, then you want to make sure that you keep your key to this medication cart on you at all times. Don't share it with other people. Don't leave your cart locked if you're not near it. If it's time for you to go on your lunch break, or if you need to go to the restroom, or if you're not giving medications at the moment, make sure that your cart is locked, because that is your responsibility while you're at work. Sometimes those carts will be numbered. When you come into work for the day, let's just say the nurse who's taking care of patients room 1 through 6 will have cart number 1. Okay, so then you know what cart belongs to you. You'll be responsible for the narcotic counts for that cart. You'll be responsible for those medications that are in that cart. So it's very important that you make sure that it's locked when you're not using it, and that you just monitor, where it is and who's around it. Sometimes those carts are locked up in a room as well. So just be mindful of whatever facility you're working in. Make sure that you know the protocols associated with this unit dose system. Know that some of the facilities that you work in, they may not even have a medication cart to roll around. They may have a lockbox in each patient's room. That makes it pretty easy. Also, you have to make sure that your patient's medications are in that lockbox. In the event that some of those patients get discharged, you may have older medications in there. So you always want to make sure it's for the patient that you're actually caring for. Okay. All right. And then we go to the computer controlled dispensing systems. All right. This is a combination of a unit dose and a floor stock system. Right. So the pharmacy comes in and they'll stock up this machine. And they'll stock it with those medications that are commonly prescribed on that unit. So let's just say it's a respiratory unit. So that medication box may be stocked with albuterol, any of the respiratory drugs that you may see. They may have solumedrol that would help with asthmatic patients. But if you have this computer-controlled dispensing system, then you're going to see those medications that are really the most used ones on that unit. Okay. For this type of system, the nurse is going to use a computer to choose the medication, and each nurse will be given a security code, and they must put that security code in order to receive their medications. All right. Either system that's used, it is your job to ensure that you are following your facility's policies and protocols when it comes to retrieving those medications. As with any job, any facility, anywhere you work, once you're given your code to use the system, it's your code. Make sure that you're not sharing it with anyone else. Okay. Okay. Moving on. Once again, I know we've gone over the 6 rights of medication many times, and we'll keep going over it many times because it's so important that I don't want you to lose sight of one of the most important things that we have to do when we're giving medications. We always need to make sure we have the right medication. We need to make sure we have the right dose of that medication. We need to make sure we're giving that medication at the right time. We need to make sure that the medication is given by the right route. We need to make sure that we are giving this medication to the right patient. And then we need to make sure that we're documenting correctly. So all of these things, please don't forget. With the lab today, there are 4 case studies that you guys are going to see that involve possibly missing some of these rights of medication administration. And you'll see once you get to the lab portion for today. But just know that this is very important, and if you adhere to these 6 rights of medication, then it's going to be pretty hard for you to make a medication error. So please, remember these rights of medication and adhere to them. None of us are immune to mistakes, but there are things in place that safeguard us and try to help us from making mistakes. So please use them. Use what they've given us. All right, so now we're going to talk about routes of administration. All right. We're going to talk about enteral administration, percutaneous, and parenteral. All right. So Remember, there's certain factors that we need to consider when we're selecting a route of administration. And we need to know how fast we need this medication to take effect. Do we need it immediately? Or, can it wait a little while? Right? So if we want it immediately to take effect, we can give an injection or we can give the medication through the IV. We need to know if our patient can swallow their meds. If you have a patient who is ordered pills, we need to make sure that they can swallow those pills. If not, we need to figure out a different way to give those medications. So those are factors that we should always be considering whenever we're selecting or whenever the provider is selecting a route of administration. And you, as a nurse, you're the patient's advocate. So if you have a patient and you know they're unable to swallow pills, or you know that they're going to vomit as soon as they swallow a liquid of a medication, then it's your job to let that provider know, hey, this patient, she's unable to swallow pills. Does this medication come in a different form? All right. And to make it even better, you can always look up that medication and say, I noticed that you've ordered a pill form of this medication, but this is also available in a liquid form. I've already called the pharmacy. They do have it available. Would it be okay to switch this medication into a liquid form? All right. So you have that power. You are your patient's advocate. So if you know that they're unable to take a medication a certain way, then please speak up for them. Okay. So first we're going to talk about enteral administration, right? These are the meds that are given and they're absorbed within the GI tract. All right, so of all of these medications, we have powders, pills, capsules, lozenges, suspensions, liquids, and suppositories. All right, so powders, we typically don't take the medication in powder form. It's usually mixed with some sort of diluent or some sort of liquid before it's given. I don't know if you guys are old school meds, but every now and again, if I get a super bad headache, I'll take a goody powder or a BC goody powder. I don't know which one they're called nowadays. But it's just a combination of a little bit of caffeine, some Tylenol, some aspirin. And they work very rapidly and they come in powder form. All right, so this one, though, I do not mix with anything liquid. It just goes straight in the mouth and then you drink something afterwards. But if you're given a powder, I don't know if you guys have heard of Miralax. Miralax is a medication that we give in powder. It comes to us in powder form, and then we mix it with a liquid for administering. So that would be your example for a powder. A pill, pills come in any shape, any size. It can be enteric coated, which means that it's going to not be absorbed in the stomach. And if you guys have been with your med terminology class, I'm sure that you guys have talked about in the word entero, meaning small intestines. So if it's enteric coated, then it's typically not going to be, the medication's not released until it gets to the small intestines, right? And it could be because it's a medication that could be caustic to the lining of the stomach, and so therefore they don't want it to start to absorb there, right? Your pills also know, you can see these pills right here, they're scored, which means that they are, there's these little indentations here. What this does is help it to make it easier for you to cut the pill in half, right? All pills are not able to be cut in half. Some pills are not made that way. So if your pills do not have a score mark here, then you might want to check with pharmacy, read your drug guide, make sure, because some pills you cannot split them up because of the way that they're formulated. I know that Allegra, if you have sinus problems, Allegra is one of those medications. You cannot split it in half. Also, Singulair. I know if you're taking a 10 milligram of Singulair, then you cannot split it in half and think that you're getting 5 milligrams and 5 milligrams. So if you're trying to stretch out your medication, some of these medications aren't the right ones to split in half. So always check before you cut them in half. Okay. Also on the same subject, there are some medications, I know, when we have older patients and they're not able to chew, or not chew, but they're not able to swallow their medications, we may crush them. There's also medications that are not supposed to be crushed. And just because they're in pill form, don't let that fool you into thinking that it can be crushed just because it's, you know, it looks like a normal pill. It should be able to be crushed. There are some medications that cannot be. So make sure that you're paying attention to those things whenever crushing pills to give to a G tube or something like that. Okay. Capsules. These are little beings where the powder or there's pellets inside this gelatin-like form, right? And these are encapsulated because they may taste terrible or because they are time released. With capsules, we want to make sure that we're not taking them apart and putting the inside materials into anything else, especially if they are time released. If it's supposed to be a time release medication and you break it open and give all of it at one time, just like that, then your patient may be getting more medication at one time than they need, and it may not sustain them for the entire day if that's what it's for. All right, so just make sure that you're not breaking those capsules apart for administration. Lozenges, they dissolve in your mouth. They're typically sweet. I always think of I think they're called Ludens. If you ever have a sore throat, they're these little cherry flavored throat saving lozenges. They're just great. They soothe your throat if you have a sore throat. But these typically dissolve in your mouth and they're typically pretty sweet. Okay. Liquids and suspensions, self-explanatory there. If you have a medication that you're giving that is a suspension, you need to make sure that you shake it before giving. If any of you guys have little ones, you ever given amoxicillin, you must shake it before you administer it to your child, or otherwise the medication is not equally distributed amongst the liquid portion of that. And then suppositories, these are medications that absorb once the substance or once the suppository melts, once it's body temperature, right? So you don't want to keep these things in warm locations because they could melt before the medication is even given, right? So these, the absorption will occur in the rectum, the urethra, or the vagina, all right? So those are all of our enteral meds. And then we'll talk about our percutaneous medications. This route is for medications that we want to be absorbed through the skin or mucous membranes, right? So this includes our patches. You know, you've got your nicotine patches, fentanyl patches for pain, nitroglycerin patches, and clonidine. So you're going to have several different types of patches for medication. They may produce a local action, but most produce some sort of systemic action, right? So fentanyl, all right, if I stick a fentanyl patch on my back, it doesn't just work on my back. It's going to be more of a systemic action that it takes to get rid of whatever pain that I'm having. Typically for percutaneous medications, absorption is rapid, right? And this can come in the form of topicals, which would be like ointments, like Neosporin, powders, creams, like Benadryl cream if you get insect bites, or if you have an allergic reaction, cortisone creams. Those things are percutaneous medications, right? If you're applying a patch to your patient, if it's a topical patch like one of these, make sure that your skin is clean and dry, right? Make sure that it is not overly hairy. You may need to shave your patient a little bit to make sure that the medication patch sticks to their skin. So if their skin is too oily or it's too hairy, it won't stick well. And then your patient's not going to receive the medication that they need to receive. Okay? We also have instillation, right? This could be sublingual, buccal, eyes, ears, or nose drops. All right, these are like your sublingual. If you have a patient that's getting, let's just say, Zofran, which is for nausea, they offer this medication in IV form, and they also offer it in a sublingual tablet, which would go straight up underneath the tongue and then it'll dissolve. That medication starts to work pretty quickly. When you're given a medication this way, it bypasses the liver, so it doesn't have to be metabolized and sent all over the body. It starts to absorb then at that point. If your medication is buccal, you're going to place it between the cheek and the gums for dissolving. All right, so make sure that when you go to give your patients their medication, make sure they know that these medications that you're giving them let's just say it's the Zofran that you're trying to give them orally, sublingually, excuse me, then you want to make sure that they know that it's supposed to go up underneath the tongue, right? You don't want them to swallow that medication. You want them to put it under their tongue, because there is a version of the Zofran that is pill form that you do swallow. But if we want our patient to have a more rapid relief from nausea, we want them to put this particular route of the medication under their tongue, all right? So make sure that you're giving that that instruction when you're giving your medication so that your patient takes it the correct way, right? We also have medications that can be given via inhalation, and that would be like our albuterols, like our inhalers. We know that even though if we're using albuterol as our example, the target for that medication would be in the respiratory system, but know that just because that's our target, it does not mean that it can affect other systems in the body. So always know your medications, always look into your drug guides, and be sure that you know what to expect the medication to, how it's going to affect your patient, all right? So if you're giving albuterol, we know that my patient, if they have asthma, they're going to start to breathe a little bit better, hopefully, once we give the albuterol. But it can also give them a racing heart. It can make them feel like their heart is racing. So you always want to make sure that you know these things so that when you give your medications to your patient, for one, will be compliant with taking their medications, and for two, they won't be surprised whenever these little nuances come up. Oh, I feel like my heart's racing after I took this medication. I'm not going to take it anymore. Well, that's not the effect that we want. We don't want our patients to not want to take their medications. We want to inform them and make sure that they know when you take this medication, it could cause you to have a racing heart. Okay. All right. And then we're going to talk about parenteral administration of medications. So this is a route that's going to be other than the digestive route. These medications are typically given with syringes and needles, right? Some medications are given this way because we want to make sure that the drug stays intact. And sometimes if we give a drug via the GI tract, via PO or something like that, then the medication could be destroyed or altered by those secretions in the GI tract. So we want to give these medications parenterally, right? We also know that some people can't swallow, or they are actively vomiting. They have, some nausea, vomiting. So in this event, if my patient is having nausea, vomiting, let's go back to Zofran for my example. If my patient's having a hard time swallowing, anything going into their mouth is going to make them vomit, then I do not want to give them any oral medications, right? I don't want to give them sublinguals. I don't want to give them any pills or capsules or anything. But I know that Zofran is also available via IV, right? So I can give them their medication via IV as long as the doctor orders it, of course. With our parenteral medications, we know that it's got a more rapid onset than taking a medication orally. So I know I want my patient to not be vomiting, and I would like for them to stop vomiting now. Of course, it's not going to happen now, but it can probably, about 20 to 30 minutes or so, maybe sooner for some people. The Zofran would start to work a little sooner than taking that medication by mouth, okay? We can typically give smaller doses of a medication parenterally as opposed to by mouth. So let's just say my patient's been getting 8 milligrams of Zofran by mouth. Well, I may need to only give 4 milligrams of that Zofran if I'm giving it IV, and it would work just as effectively, okay? If we give our medications via IV route, then the speed of administration can be regulated. So if I'm giving this medication via IV pump, which you guys have been working all these lovely problems with your calculations and your dosages, IV flow rates and things like that, we can regulate the speed of the administration of the medication. So if I want this, let's just say I want this Phenergan, which is also for nausea, I want it to go over the pump for 30 minutes. I can do that as opposed to 10 minutes. I can set that to happen via my IV pump, right? So your parental Medications, you will get them by, they come prepared in either ampules, which are little glass containers that you must snap off the top with either a collar or a gauze or some alcohol swabs. These are typically single use. And when you use them, when you drop your medications with an ampule, and we'll show you guys this as time goes by with this class, you will need a filter needle to prevent the glass from being drawn up along with the medication, right? So you would open your ampule, insert your filter needle that's attached to your syringe like this, and then you'll withdraw the medication, and then you will take that filter needle off and put on the needle that you're going to give the medication with if you're giving it injection. Okay? And then you also have vials. Vials can be single use or multi-use. They typically are sealed with a metal cap, and they have a rubber diaphragm in the middle that you draw your medications out with. All right. Make sure you're checking for latex allergies with your patients, because sometimes that would be that could cause a problem with your patients. Okay. If we're given our medications parenterally, we could give them IV, which would be intradermal. We could give them IM, which would be intramuscular. They can get them subcutaneously. We could give the medication IV as well. Okay. Right? Taking a little break from those medications for just a moment, I did want to remind you guys about your Joint Commission's do not use list. This list of abbreviations are things that you should never use when you're in a facility. They should always be posted in your facility. And if you ever forget, the Joint Commission always has them on their website. So I'm not going to click here, but if you want to see, it is there. These are those abbreviations like writing U for units instead of spelling out units. So you want to make sure that you're not doing that. Actually, let's go ahead and click on there. All right, so this is your official do not use list. All right, there aren't many on here, but make sure that you know these so that in the event that you see medications written out, you know what's right and what's wrong. All right, if your doctor has written out give 4U of insulin, make sure that they rewrite it to write the whole word unit. All right. We shouldn't be seeing QD or QOD. They should handwrite out daily, every other day, and so forth and so on. So make sure that you're familiar with this official do not use list, because it is very important to ensure that we do not have any medication errors based on some of these abbreviations that we should not be using. All right. Go back to our slide there. Right. We'll talk about transcribing orders as well. You know, I know some of this is repetitious because we've talked about it in previous weeks, but these things are very important, and I just want to make sure that you guys are very well aware of all things medication administration. Right? So make sure that you are transcribing these orders properly. If you're getting a verbal order from your physician, make sure you're writing it down at the time that the order is being given to you. Don't try to remember it after you've gotten off the phone. Don't do that, because you may get the order wrong, and then you have a medication error. So if your doctor is giving you medications, make sure you have pen and paper handy and write it down as the doctor gives it to you, and make sure that you read it back to him to make sure that you've got it correct, right? These should be transcribed or entered into a computer by your facility's policy. Some facilities aren't on computers, and so then you would need to handwrite it. So whatever your facility does, make sure you're following those policies and protocols that are in place. If your information that you've gotten, the orders that you've gotten is not clear, make sure that you clarify it with the healthcare provider so that you don't try to give the wrong medication. Okay. Once again, we'll talk about controlled substances. We talked about this last week. Those are those substances that include opioids, barbiturates, and other medications. If you guys haven't covered this yet in pharmacology, it's going to be like your oxycodone, Vicodin, morphine, codeine, any of those medications. These all have a high possibility for abuse. for addiction and or theft. All right, so if you're working in a facility, these substances must be kept in a secured area. Remember, we're going to be doing narcotic counts at the beginning and the end of our shifts. And if there's any discrepancies, then it's highly likely that no one's going home until we can figure this out. Expect to have drug testing done because we want to be sure of what's going on. All right. All right. So kind of jumping back to those parental medications. So if we're talking about parental medications here, and I want to give an intramuscular injection or an IM injection, make sure that you choose a site that's free of pain. So if your patient's right arm is hurting, if their right upper arm is hurting, then you don't want to give an injection to the right upper arm. Maybe use the left upper arm, right? Make sure there's no infection there, right? You don't want to accidentally open up the area to more infection. Make sure there's no necrosis, there's no dying tissues, no broken blood vessels or ecchymosis, and no abrasions there. So you want to make sure that the skin is intact where you're trying to give your injection, right? Make sure that you know the location of underlying bones, nerves, major blood vessels. This is why it's very important that you study your A&P, because when you're giving injections, you don't want to hit a nerve, you don't want to hit a bone, you don't want to hit any major blood vessels, all right? Make sure you're verifying the amount of solution to be injected. Most orders, most if not all, will tell you the amount of solution to be injected, okay? So make sure you're adhering to that. The ventrogluteal site is a preferred site in adult patients, not for children, but the vastus lateralis and the deltoids can be used as well. Know that you must, if you're giving an IM injection, you must put the needle into muscle tissue, okay? You can't just, halfway put the needle in and call it a day. You must make sure that you're going into muscle tissue. Otherwise, you have committed a medication error, and that medication may not be absorbed properly, all right? So know that your muscles, they have a large blood supply. So when you're giving those IM medications, they are absorbed faster than meds given subcutaneously, all right? So make sure that you know if you're supposed to be giving an IM medication, give it IM. If you're supposed to give a subcutaneous medication, make sure you're giving it subcutaneously, right? Wherever you inject, when you go to do your injections, make sure that you ask your patient to relax. I know it's easier said than done, but your injections will be less painful if the patient's muscles aren't as tense, all right? So that's just a little tip I've learned throughout the years, that, try to relax as much as you can, even though I'm going to be jabbing this needle into your skin, okay? Right, and so here are some sites for intramuscular injections, just to help you kind of remember. All right, let's start off with ventrogluteal site, all right? This is preferred because it is the greatest thickness of the gluteal muscle, all right? There's fewer nerves, there's fewer blood vessels here, and so it's a great place to give an injection. So what you'll do is you'll put your palm on the lateral portion of the greater trochanter, your index finger on the superior iliac spine, and then you extend that middle finger toward the iliac crest. Your fingers are going to end up forming a V when you place them on this area, and then you will give the injection right in the middle, okay? Your patient can have this injection either side lying or standing, and it's a great place to give, because like I said, it's got a lot of muscle there. So except for in children, we do not want to give children anything gluteal, any medications to any portion of the gluteal area, okay? If we give medication to the vastus lateralis, that's going to be this portion, that's the outer portion of the thigh here, right? We prefer this in kids. There's no nerves, there's no blood vessels. You can give it while they're lying supine or they're sitting. What you would do if you're the nurse administering this medication, you would put one hand above the knee and the other below the greater trochanter, and then you're just going to inject the medication between your hands, right? So this is a great place to give medications as well. All right, the deltoid, this is also a good place to give medications. It's a smaller muscle, so it can't take as much medication as the other two sites. but it is still a good site to give. You know, you get your flu shots here, and most of your immunizations, especially as adults, we'll get our immunizations here in this area, in our deltoid. So you're going to give your IM injection 3 finger breaths down from the acromion. So right here, right? You're going to go 3 finger breaths down from the acromion, and the injection site is 3 to 5 centimeters down. So anywhere in this area is your target space, okay? And then the final is the dorsogluteal site. We don't use this site very much. This has a higher risk of nerve damage because you have your sciatic nerve back here. So, and we don't use this site in children at all. So I'm not going to spend too much time on that one because it's just not, we just don't use it as much because it's just not as safe as the others. Right. Moving on from IM injections, we'll talk about eye, ear, and nose irrigations. So irrigations is just gently washing an area with a stream of a solution given through a syringe. For eye irrigations, if you get something in your eye, then we're going to rinse it out. We'll irrigate it with probably some saline, right? For ears, I know little ones, we have to do this often, sometimes. Ear irrigations, there's certain doctors prefer certain things for irrigating those ears. Some warm water, make sure it's warm because cold water can make your patient dizzy. But warm water or some warm saline water, peroxide, mix some sort of solution that you're going to give through a syringe, and then you'll just kind of squirt it in the ear until we get all of the wax out of there, all the cerumen or wax out of there. Okay. Keep going here, and then our last slide here, I believe, if I'm not mistaken, is vaginal and rectal medications. Remember I said earlier that if your patient is taking a suppository, you want to make sure that you keep that medication cool. Store it in a cool place because they dissolve at body temperature. So if you keep them in a warm place, then they're going to melt before you are able to use it, right? These medications are absorbed directly into the bloodstream. So just be careful with use. Please don't try to cut them in half. Make sure your pharmacy has the dose that you need, okay? These are also useful with nausea, vomiting. Let's just say you or your child or your patient, whoever has a fever and you're having a hard time giving Tylenol orally. Well, we can also give Tylenol as a suppository per rectum. So those things are available. We just advocate for your patient and make sure that you can give them, right? And then I wanted to talk about vaginal medications. Remember that we've got douches mentioned here on our screen. We want to make sure that we're not recommending them to our patients because they may predispose your patient to develop vaginal infections, right? That happens, then they're going to need to have some topical application of anti-infective agents, all right? So make sure that your patient, you know, when you're doing your patient interview, especially if it is her yearly exam, then you want to make sure that, you know, she's not doing these things, all right? Because those things, the douche can irritate the vaginal mucosa. And we want to make sure that we're not putting her in that position to be developing infections, okay? All right, this final slide that I'm going to show you guys, this has just some orders on here just to make sure that you guys are remembering what's required of a doctor's order, and that you're reading these abbreviations. You know, we know the first one, it says Cardizem ER 240 milligrams PO/Q day, right? Just making sure that these things look and are correct and that you can understand the language behind them, all right? So you guys can take a look at those and then we'll come back for lab, okay? All right, take a break, guys, and then when you guys get back, we'll go ahead and move into your lab for today. Fast forwarding your lab for today. All right, so today you're going to read or watch the following 4 scenarios, and you'll answer the questions that follow each scenario, okay? I've got this whole thing listed in Canvas as well. It's on a Word document, so if you want to download that document and just answer your questions there, that's fine. But write it down or type it down after you've read each scenario, because I want to talk about this and go over it next week in week 7. These are all case studies of medication errors. So I want you guys to go through these and answer the questions that go along with them, all right? So I'm gonna just kind of speed through on this just so that you can see that it's here on this PowerPoint presentation as well, but I've also put a document on Word that includes the links for you to go to either the videos or to read the scenario, okay? Don't worry, guys, they're not that long. They're very interesting, and they really help to bring home this information that it's very important that you're following those rules to medication administration, all right? So the first scenario is going to be a YouTube video. Once you watch it, it's only about 10 minutes long, but once you watch it, if you'll come back and answer these 3 questions for me, shouldn't take you too long. I'm not looking for an essay, just, you know, a recap of how you felt when you watched this video and what contributed to the incident occurring and what you could have done differently. And then this scenario, it's a little bit wordy, but once again, it's very interesting. It's really helping to understand our rules of medication administration. The link to, no, this link is not there. This one is just the words. So on your Word document, you'll have the same thing there. And then there's a few questions for you to answer regarding scenario number 2. Okay. And then you have scenario number 3. I give you the actual scenario, and I have some questions for you as well on this one. And then for the final one, you will go and read this article. Don't worry, it's not long. It's not hard to read at all. And you may have heard about it in the news last year because it was a pretty big deal last year. So you may have already be familiar with the situation. And there are 4 questions for that one. So just, you know, kind of put it in your mind. Think about these scenarios while you're reading them and watching them, and try to answer these questions for me. And we'll talk about this next week for lab, because I think it's a great talking point on things that we need to be mindful of when we are giving our medications, okay? So make sure you do them, hold on to your answers, and then when we come back next week, we will go over them, all right? Thanks, guys. Have a great day.